Hello everyone, I am back with some more guides and then some more diagnoses, interventions and diagnostics and nursing interventions and education and teaching that we're going to talk about today. Today we are talking about the musculoskeletal system. So let's start. First, let's talk about rheumatoid arthritis. We are most of the people familiar with arthritis, rheumatoid arthritis. Um, what happens or what the rheumatoid arthritis affect? So it affects the eyes. Most of them gets the cataracts, the bones, the muscles, right? It's a systemic. It is not just happening in the joints. It can move to other parts in the body because the body is attacking itself. What are 5 common symptoms? Remember, these symptoms you are going to you are going to see them in your exam. Okay, if you're talking about musculoskeletal system, we're talking about arthritis. You're gonna see these common symptoms: joint pain. They all complain of joint pain, swelling, right? Nodules, stiffness in the morning. Stiffness turns into contractures where they can no longer move, and of course depression because of the pain. They're always in pain or because of the deformity of the body. So if the patient or the person is experiencing swelling, what are you going to do with it? You're going to treat it with some cool, okay? And then for the stiffness in the morning, you're going to use heat and warmth. Remember, swelling, you're going to use cool. It's stiffness, you're going to use heat and warmth. And you're going to encourage them to take a shower in the morning, like a warm shower in the morning upon waking up. I like 99% guarantee you that's going to be in your exam. So remember, swelling, cool, stiffness, heat. What is the common symptoms and what time of the day? Again, stiffness and pain, and mostly is in the morning upon waking up. Raynaud's phenomenon, basically it's a cold causes vasoconstriction of the vessels, resulting in blanching and cyanosis of the fingertips. Cyanosis means cyanotic, means there's no oxygen flowing, means they're going to turn blue or bluish color. It's like when you're super cold, start going white, and then it starts fading away to bluish color. That's the extreme. But that's Raynaud's phenomenon. What is Sjogren syndrome? I never knew how to pronounce that, and I still don't. So basically what it is basically dryness in the eyes, mouth, and neuropathy. Okay, we're gonna do 5 lab findings to help diagnose the disease. 1, you're gonna have an increased rheumatoid factor. Okay, you're gonna do an ANA, anti-nuclear antibodies. You're gonna fast for 8 hours prior to the test. You're gonna have an increased WBC, an increased CRP, and an increased ESR. And you're gonna, if you want to test for these, you are going to fast for 4 hours prior. These are important information. Remember, ANA, you're gonna fast for 8 hours. CRP, ESR, you're gonna fast for 4 hours prior. Okay, you're gonna do an X-ray. You're gonna pull out some synovial fluid, and then you're gonna see that it has a lot increased levels of WBC. You are going to do a bone scan, right? They're gonna put a radioactive agent in the IV, and of course, we don't do these with that test with pregnant women. What 3 drug-modifying antiemetic drugs, which is ARDS, used for treatment? We use methotrexate, which is an immune suppression, right? And it's no sick people. What is methotrexate? Methotrexate is basically a chemo agent, right? So when you take methotrexate, you want to be mindful that with all chemo precaution, we're talking about like make sure there's no spills, make sure if the patient throws up, make sure all these fluids you don't get it exposed to other people or to the nurse. Make sure when you're flushing the pee of the patient, make sure you cover it so it doesn't splash. Okay, remember these. Second, we have the sulfasalazine, and we have the hydroxychloroquine. So that, make sure you remember these three. What are three other types of meds we use for treatment? We could use steroids. It's gonna cause weight gain, fluid retention. It's gonna increase the blood sugar, and it's also given via injection into the joints. We're gonna use NSAIDs and biologics. Some non-pharmacological meds that interventions that you can do is PT, OT, splinting while sleeping, range of motion exercises, cold and heat therapy. Let's talk about osteoarthritis. Osteoarthritis, basically, you always look at the word and split it into osteo, bone, arthritis. So inflammation of the joints, right? It occurs from wear and tear, and it's basically a breakdown of the cartilage. It can be unilateral. It can happen on one side. It doesn't have to be bilateral. Common symptoms: pain, more pain with use, cryptus, and fatigue related to pain. You can do 3 non-pharmacological interventions like rest, weight loss, OT, PT, and use of assisting devices like cane, walker, crutches, for a younger person. What are 3 possible pharmacological interventions? You can give Tylenol, opioids, injection of steroids, and just creams like Bengay. Now, most of you need to start memorizing these, because what can you delegate to the nurse assistant and when you cannot delegate. Okay, your Nclex is gonna have a lot of delegations, so start now. If you see this video, start working your delegations now. One thing you can delegate to your CNA is range of motion exercises, right? However, you do never, ever, okay? You do not delegate an action that was not taught before. The first time teaching is always going to be by the nurse, and then you can delegate after. And again, weight loss and smoking. Hip and knee arthroplasty. It's basically a replacement of the hip and the knee, right? Hip or knee. Prior to surgery, what's important that you need to know that the nurse needs to complete? Antibiotics. Make sure you do pre-antibiotics. Make sure you have the informed consent signed by a witness, which is you, the doctor, and the patient. Before you sign an informed consent, you want to make sure you ask your patient, do you understand fully the benefits, the risks, the consequences, and everything else? If the patient says, yes, I do, you sign it. If the patient says no, you're not going to sign it. What are you going to do? You're going to call the doctor, tell them to come back, and educate the patient about the surgery. And then you can sign. And you want to ensure the resources for rehab after surgery. And of course, the OR nurse needs to make sure to do timeout during surgery. What medical equipment is used post-op for hip and knee arthroplasty? Abduction pillow, which is a hip replacement. Like the hip replacement, when you do it, you're going to give you an abduction pillow. So the abduction pillow, that most exams ask about abduction pillow when it comes to musculoskeletal system. CPM, which is basically continuous passive motion. You want to see them as soon as possible up and ambulating. If they do not do that, there's a lot of interventions that you can do in bed, like range of motion exercises, giving Lovenox and anticoagulants to prevent any DVTs from happening. What are 3 priority assessments following surgery? Of course, you want to check the surgical site. Why are you checking the surgical site? Because you want to make sure that the surgical site is free of redness, there's no drainage, it's not infected, there's no infection. You need to do neurovascular checks, right? So distal pulses from the surgical site. You want to make sure the temperature of the foot, everything's fine. You're going to wiggle your toes, is everything okay? And of course your ABCs. And you want to never take off the dressing of the surgery site. That has to be done by the doctor. Medications after the surgery, basically they take pain medications and Lovenox and anticoagulants. Myelitis. Basically it's infection of the tissue. What are 3 causes? The first cause is diabetic ulcers, which is like stage 4 ulcer, surgery, trauma, blunt or open, or tumor, bone cancer. Okay, so 3 diagnostic tests you're going to do is ESP, CBC, blood culture, soft tissue biopsy, and bone scan. The patient who is at risk for osteomyelitis, you have diabetic patients, older population, poor hygiene, immobility, and immunosuppressant patients. There's 3 pharm interventions. These are important: antibiotics, IV for 4 to 6 weeks, pain medications, NSAIDs, and muscle relaxers. Long-term osteomyelitis can result in amputation. What type of diet? You're gonna have the high protein diet. Okay. Now let's talk about lupus. Lupus is an autoimmune disease. It affects younger women. An autoimmune attack of the body tissue that causes damage eventually to the organs. Fatigue is the biggest issue. They're always tired, pain, hair loss, infection related to the medications they take. Symptoms, musculoskeletal symptoms can be arthritis, increased bone loss, and fractures, or easily fractured. They're gonna have the butterfly rash on the face. Remember this one? I had it on my Nclex exam. And renal failure, seizures, memory issues, and of course it depends on the stage of lupus and how advanced it is. Labs we do is CRP, ANA, and ESR. Medications they're gonna take the hydroxychloroquine, NSAIDs, corticosteroids, and methotrexate. Patient teaching, infection medication and how to prevent it, and what would you do if you actually suspect an infection. Pneumonia is the most common of that death, that results in death in extreme cases. They do not take no live vaccines, right? Because of the medications and related to the medications and how they're autoimmune. It's an autoimmune disease, right? So they're already immune suppressed, and so you don't not give live vaccines, okay? Skincare and prevention of flare-ups. Scleroderma is 5 common symptoms: shortness of breath, fatigue, and stiffness and weakness. But what I really want you to remember is CREST. Basically, CREST syndrome, right? Remember that. 1. C. Calcinosis. You're gonna have calcium and salt deposits. Raynaud's phenomenon, which is the most common symptom. Esophageal dysfunction, which is risk of aspiration, right? And then you have the sclerodactyly, which is tingling of the fingers and the skin. And then you're gonna have the spider veins. List of 3 complications. You're gonna have Raynaud's phenomenon, kidneys, and lungs. Pulmonary hypertension, most likely. 3 diagnostics tests. You're gonna have an X-ray, echo, the heart, urinalysis, and biopsy to assess the kidney function, and of course, see the antibodies. There's no specific drug treatment for that. There's 3 types of medication used. For treatment, we have the vasodilator, prednisone, methotrexate, antihistamines, and topical ointments for the skin.